maybe getting up to closer to 3 times more likely. On a large-scale basis, increased likelihood of ultimately receiving one of these diagnoses later in life. There are other ways that this type of exposure can influence that process, though. Maybe not so much that it was the reason you developed the disease in the first place, but something we care quite a lot about is, when did the symptoms start? When did you first start having problems? We'd like to have that start as late as possible if it's going to happen at all. And there's a whole separate area of research suggesting that if you've had a traumatic brain injury, compared to people that haven't, your symptoms start a little bit earlier in life, on average about 2 to 3 years earlier. And maybe that's hard to think about way down the line, but if you put yourself in the shoes of someone who's 75 years old, and you ask, would you like to have your symptoms now, or do you want to wait 2 to 3 years and have a little more of a runway before you're having to deal with all this? If we were able to come up with a treatment that delayed or slowed a disease by 2 to 3 years, that would be an immense level of progress in the dementia field. Right now, we're pretty stoked about 3 to 6 months of slowing with some of our Alzheimer's disease drugs. And even that is a meaningful amount of time. So 2 to 3 years is a lot when you're talking about what that might mean for a preventable risk factor like brain injury.